Local anesthesia, supraperiosteal injection. The equipment needed for this procedure is as follows: personal protective equipment, syringe, 27-gauge short needle, gauze, anesthetic cartridge, topical antiseptic, optional, topical anesthetic, cotton tip applicator, and hemostat or cotton pliers. The supraperiosteal injection, commonly referred to as local infiltration or field block, is generally recommended for anesthesia of individual teeth and associated periodontium, as well as facial or lingual soft tissue. It is not recommended when several teeth in the quadrant need to be anesthetized. The supraperiosteal injection can be accomplished on any tooth via deposition of the anesthetic solution adjacent to the periosteum overlying the apex of the tooth to be anesthetized. It is rarely used in the mandibular posterior teeth because of the density of the mandibular bone in adults. In the maxillary arch, with its relatively porous bone, the anesthetic solution readily diffuses through the thinner facial plates of the maxillary bone to anesthetize the terminal fibers of the dental plexus. Therefore, the injection can be used on any tooth. However, because the anesthetic is deposited in close proximity to the area of treatment, any severe inflammation or infection in the area may inhibit the achievement of profound anesthesia. The landmark for this injection is the mucobuccal fold of the tooth to be anesthetized. The deposit location or target area for the supraperiosteal injection is the apex of the selected tooth. Because the root lengths of teeth vary among patients, the depth of needle penetration will vary among teeth and among patients. For the maxillary arch, review the average root lengths of maxillary teeth to help make this adjustment of needle depth more accurate. The injection site is the height of the mucobuccal fold at the apex of the tooth to be anesthetized. For this demonstration, we will be anesthetizing tooth number 10. Load the local anesthetic syringe as demonstrated in the procedure, loading the metallic or plastic cartridge-type syringe. Before injection, follow all steps as demonstrated in the procedure, basic injection technique. Assume the correct operator position according to the area to be anesthetized. Ask the supine patient to open his mouth and then retract the upper lip, pulling the tissue taut using the thumb and index finger of the non-dominant hand, one inside and one outside. You may use a piece of sterile gauze to help retract slippery tissue. Palpate the injection site to ensure that only soft tissue is injected. Dry the penetration site and prepare the alveolar mucosal tissue with topical anesthetic in the vestibule at the height or depth of the mucobuccal fold at the apex of the selected tooth. Topical anesthetics are most effective for patient comfort when applied for 1 to 2 minutes. Dry the tissue to remove any excess topical anesthetic. Using a 27-gauge short needle in the syringe in the dominant hand, orient the bevel of the needle away from the large window of the syringe to ensure bevel orientation toward the bone. Establish a fulcrum that allows you the greatest stability of the syringe. Place the syringe parallel with the long axis of the tooth, with the large window facing you. Insert the needle at the height or depth of the mucobuccal fold, parallel to the long axis of the tooth, and insert the needle approximately 1/4 of the depth of the short needle, approximately 5 millimeters, or until the bevel is slightly superior to the apex of the tooth. You should feel no resistance or bony contact. Aspirate by pulling the thumb ring back gently on 1 to 2 millimeters at the injection site to prevent the possibility of an intravascular injection. If a negative aspiration is achieved, slowly deposit approximately 0.6 milliliters of solution, 1/3 of the cartridge, over approximately 30 to 60 seconds. If the tissue balloons, you are injecting too rapidly. Carefully withdraw the syringe and immediately recap the needle using the one-handed scoop method with a needle sheath prop or other recapping device. Rinse the patient's mouth to wash out any anesthetic solution that may have dripped into the mouth. Wait approximately 3 to 5 minutes until anesthesia takes effect before beginning treatment. Complications are rare with this injection, but can include some discomfort if the injection is too close to the periosteum. It is important to keep the needle parallel to the bone.